Hi, everyone, and welcome to our presentation on dermatitis. My name's Katie, and I'll be taking us through the beginning of the presentation. So what exactly is dermatitis? Dermatitis is a non-contagious skin condition characterized primarily by inflammation. There are three different types of dermatitis that we'll talk about. First is atopic dermatitis, which is also known as eczema, and it's a chronic condition causing dry, itchy, and discolored skin, and it also has a genetic component associated with it. Contact dermatitis is an acute condition caused by contact with an irritant, and that's also very similar to allergic dermatitis, which is an acute condition caused by contact with an allergen. Some classic signs and symptoms of dermatitis include itching, redness, rash, dry skin, fluid-filled blisters, thickening, hardening, and swelling of the skin, crusting, scaling, and creasing of the skin, and painful ulcers. Some things that you can do at home that don't require medicine at all are cool compresses, which help reduce inflammation and reduce the urge to itch. And then to prevent flare-ups of eczema or just contact/allergic dermatitis in general, you should be avoiding irritants and allergens and being aware of fragrances and skin products that might cause you to flare up or have a reaction to it. Avoid hot showers so you're not drying out your skin. Wearing loose clothing to avoid skin chafing and problems with your skin barrier. And then also managing stress, which is very important in the management of atopic dermatitis.
Hi everyone, my name is Elidio, and I'm going to be going over topical corticosteroids to begin our over-the-counter conversation. Topical corticosteroids, the only available formulary is hydrocortisone, and the only over-the-counter strengths that are available are 0.5 and 1% strengths. We've talked about these before. We know they work by binding to intracellular receptors to reduce inflammation, suppress immune activity, and cause vasoconstriction. Long-term use can lead to adverse effects such as skin thinning, stretch marks, dermatitis exacerbation, and hypopigmentation. Some important drug interactions to mention to patients that are going to be on this drug include interactions with mifepristone, desmopressin, the fluoroquinolones for tendon rupture, and some vaccines. The only available formularies that are over the counter are creams and ointments. And the special population that I chose to work with was the pediatric population, as absorption is higher for them due to thinner skin and larger skin surface area. So using lower potency medications is a must. As far as ingestion as well, we want to focus in on safety in terms of ingestion and storing medication appropriately. Topical steroids are safe to use in pregnancy and for breastfeeding, but the area should just be wiped clean prior to breastfeeding. Next, please. So as far as cost goes, the application process of topical corticosteroids, we want to use, research says, about 2 to 4 times daily with no more than 2 to 4 weeks of treatment. We measure dosing using fingertip units. So a fingertip unit is approximately a half gram. So for example, if we wanted to, just like on the bottom of the slide, we wanted to do an adult 1-arm BID for 2 weeks, the cost of a tub is about $5.99. So it would bring your cost of treatment for the entire 2 weeks to approximately $12 with some tax. So it's a very cheap and affordable treatment method. Next, please.
Okay, my name's Autumn, and I'll be going over antihistamines. Antihistamines stop the release of histamine by binding to receptors, typically H1 receptors, and they are used to decrease inflammation, swelling, and itching in dermatitis. Because there is so much information on antihistamines, I'm just going to cover the big things today. But the key differences is that there are first generation and second generation antihistamines. And first generation antihistamines, such as Benadryl, are less specific and cross the blood-brain barrier. So this makes them more likely to be sedating. In current practice, the research and literature points more towards the use of second generation for dermatitis. Okay, next slide. Thanks. Okay. First gen is more likely, as stated before, to cause drowsiness and anticholinergic effects. So just be sure to monitor for those effects. They can even include things such as seizures, but there are quite a few meds available in the first gen. Okay, and then regarding second generation, there are also quite a few meds that are available over the counter, but they are more selective to receptors on the periphery, so their effects are similar, but they don't include as much of the drowsiness and neuro-related things that you might see. And then the antihistamines, since they've been around for so long, are widely available and come in just a myriad of dosage forms. This allows for convenience, especially in populations such as pediatrics who can't just take pills or tablets. Just diphenhydramine alone is available in 300 different combinations, and then all those combinations also include various forms. So there are plenty of options when choosing over the counter. Okay, and then regarding special populations, like I said, there are lots to consider, but I'll kind of highlight the really big ones that we want to look out for. In pediatrics, it is contraindicated to give children under 2 any over-the-counter antihistamines. This is due to the fact that they can cause respiratory depression, so that's not something we ever want to give in that population. And then kind of the other really big one that I'll highlight today is geriatrics. Older adults are really at risk to the effects from first generation medications, and this is listed on the Beers criteria, like we've talked about in class. So that is something that really needs to be avoided in the geriatric population. Okay, and then with medication safety issues, the biggest problems, like I've said before, are the sedation and the impaired coordination, and then the anticholinergic effects that we can see in both generations. The consequences to these problems include falls and accidents, and then urinary retention, blurred vision, dry mouth, things like that. Really, the best way to prevent these errors is select second generation antihistamines if possible. I mean, that's not always the case, but if you're able to, that's the better choice typically. Read labels, follow directions, evaluate for polypharmacy in the geriatric population, and then just really monitor closely if you're giving these medications. And then because these medications have been around for quite a bit of time, they're fairly inexpensive. Generally, over the counter, you can find a bottle of tablets for really either options. I base this off of Benadryl and then Zyrtec. You're looking around $18 to $19 for a bottle. Second generation requires less dosing frequency, typically 1 pill a day based on adult dosing. So that's easier for adherence and then treatment options.
All right, so I'm Sky and I am doing topical emollients. So these are essentially just our everyday moisturizers. They moisten and soften our skin by restoring and hydrating the stratum corneum. So they fill in spots of desquamating skin with lipids and oils. And then they also contain occlusive products, which can form a hydrophobic film on the skin to reduce transepidermal water loss. Some other formulations will also contain humectants, and these attract and hold water in the outermost skin layers. So aside from these key ingredients, there's also a lot of other added ingredients that are in some differing formulations and products as well. Next slide, please. In terms of adverse effects and drug-drug interactions, there's not a whole lot of systemic interactions because there's minimal systemic absorption of these products. You can have some topical interactions, so applying emollients prior to corticosteroids can cause a decrease in steroid penetration and function, so that's something to be aware of. And then greasy emollients can enhance absorption, so want to be wary of that as well. Adverse effects, there's less severe adverse effects or no symptoms at all. However, you can still have some reactions, especially if you have a known allergy to one of the ingredients that are in the products. And then, as mentioned before, too, emollients can make dermatitis and other skin conditions worse due to those fragrances, preservatives, and allergens. So just want to be cautious of that too. Next slide. So here's a little summary of all the available dosage forms. There's a lot of different dosage forms and a lot of different products within each dosage form. So it's all just a different combinations of ingredients in each one. There's some examples there at the bottom in blue, most of which I'm sure all of us are familiar with or have seen before. Next slide. For most of the populations, emollients are actually considered a safe option and are generally recommended and encouraged for dermatitis. However, with anything, there is always a possibility of adverse effects. So pediatrics run the risk of increased risk for skin irritation due to their thinner skin and it being more permeable. And then geriatric populations are at an increased risk for folliculitis. Folks that are breastfeeding want to be cautious of any emollients on their nipples and ensure to clean the nipple prior to breastfeeding and also just try to apply emollients after breastfeeding. And then diabetic patients run the risk of maceration or infection between the toes. So being cautious of that will be important also. Next slide. Safety issues. There is a fire risk with the paraffin-based products, especially in those occlusive emollients, and then also severe reactions like anaphylaxis. So the biggest thing here will be education. Next slide. The cost just really varies person to person. Emollients are generally used generously and frequently. Some sources say even at least 3 to 4 times a day. So it just depends person to person and skin condition to skin condition. Next slide. Here are some prescription options for dermatitis if the over-the-counter emollients are insufficient. Urea-containing creams, lactic acid-containing emollients, and then ceramide-dominant barrier creams also. Next slide.
Hi, I'm Carolyn, and I'm going to be talking briefly on topical zinc oxide. So this acts as a mild astringent, and it has weak antiseptic properties. It helps to protect the skin by forming a moisture barrier, and it reduces inflammation and itching by inhibiting mast cell degranulation, which decreases the histamine release, which is a major trigger for inflammation and itch. So you'll find zinc oxide in many of the over-the-counter products, including things like Desitin, Balmex, Boudreaux's butt paste, Parashield, and Z-Guard. It's available in creams, pastes, powders, aerosol sprays, and the concentrations really range from about 5% to 40% zinc oxide. And they have some less common strengths as well, like 11, 13, 22, and 30%. It's generally considered to be very safe with no significant adverse effects or drug interactions. But patients really should still be counseled to seek medical attention if they experience anaphylaxis, so rash, hives, swelling, difficulty breathing. In terms of dosage, sorry, next slide, please. You're really looking to kind of apply it throughout the day. And so you apply liberally as needed. You can use a dry tissue to blot any excess off. You want to think about buttering bread, not icing a cake in terms of the amount that you're going to be using. It should not be applied to the eyes, to deep wounds or burns. And again, really should be avoided by people that are allergic to zinc, lanolin, dimethicone, or petroleum-based products, because these are frequently included in the formulations. And there are no dosage adjustments to think about for the pediatric, geriatric populations or with renal and hepatic impairment. Again, you want to consider just wiping the area prior to breastfeeding. And then costs really vary depending on the brand and the size. So they typically range about $5 for about 30 grams to $35 for 113 grams. Next slide.
I'll just briefly go over the prescription options. I sorted them into 2 categories, one for contact/allergic dermatitis, and then one for atopic dermatitis, also known as eczema. The biggest thing to note about contact and allergic dermatitis is just avoid the irritant and allergen, but you can get some stronger topical corticosteroids prescribed, as well as some PO antihistamines like hydroxyzine that can't be prescribed or can't get over the counter. And then I've also listed all these other treatments for eczema. Thanks so much for listening. Here are our references.